know, if an electrician has a wall, he has to go through that wall to get to where your plug is, right? So that's really what the history of learning about our hippocampus has been. And that brings us up to 2006. In 2006, if you haven't read, I'm sure most of you have, David Snowden, Aging with Grace, and the Nun study. Well, that study, what was significant about that study? All the nuns lived in the same place, the same environment. It was a pure cohort. And what they found was he correlated, and actually I used his study and replicated mine to a nursing home, correlating the amount of therapeutic activities. He correlated just the amount of activities to cognitive functioning and the ability to get Alzheimer's disease or not. Now, the most exciting thing for me, and I still have not gotten the slide of this, but when I was on my Fulbright and I was speaking in New Zealand, I was one of the keynote speakers to the New Zealand Alzheimer's Association. And I was very proud of the organization. I was proud of my profession to be perceived as an art therapist and a doctor and speaking at a keynote, because who would have thought? So, the night before the keynote presentation, I meet the other keynote presenter, who was Dr. Richard Fall. And they're taking us out to this beautiful dinner there. It's the first time I'm having real New Zealand lamb. And I sit down next to him and he says, "What are you presenting on?" And I said, "Well, I'm presenting on a method of using themes with the Alzheimer's population to stimulate the brain." And he starts to say, "Well, I have broken the sound barrier of the hippocampus." And I was like, "Oh my God." And at that point, they give me my lamb, and I said, and they serve him some. I said, "Please finish. What is it about the hippocampus?" He says, "Well, I'm going to be stating tomorrow for the very first time that our neuroscience lab filmed the hippocampus making new brain cells in 87-year-old people and 93-year-old people and 100-year-old people right before the end of death." So, and he actually has won the Nobel Prize in 2008 for his work. And what he showed was these images of the hippocampus he called it a pathway. And in New Zealand, there's the Auckland pathway, so he called it the Auckland pathway, because you saw the pathway continue to be created, which we didn't know. We didn't know that it could be still to the end of death. The interesting thing that I didn't say, which I think has all to do with art and the use of art, is that we don't know one important thing yet about Alzheimer's disease in the brain. We don't know why it affects the left side more than the right side. Because if you think about your patients, they don't know the words to things, but they'll be able to choose a color and color. They'll be able to tell you, "I like these blue tiles, not the red ones," but they won't know what's called a tile, right? So that's the differential of the regional functioning of the brain. So that's very significant, and I'm sure that in the next 2 years, we're going to find out why that is. We don't know right now. Let me ask you all in this room, when you're using your motor cortex of moving, what are some of the creative aspects that you do with your patients that you're stimulating their motor cortex and you're not even thinking about it?
On the lines of
cutting, dance, painting, anything moving the body, right? Using an instrument, using a scissor, using drums, anything with the hands, the body, the legs. Frontal lobe, problem solving. That's a big one. When you'll see some clips later. I'm going to play some clips while you're doing some experientials. You'll see some individuals saying, "Wow, I really use my brain. What we did this morning was really a workout on the brain," because they're using the frontal lobe and it's problem solving. What do you do? What do you do for problem solving? What do you, in your everyday practice, you do millions of things for problem solving.
Choices.
Yes.
Choices, what else?
I do bringing in objects and saying, what is it?
Excellent. What's the object and what does it mean to you? We're going to be doing a lot of that today. That's an excellent way to get at a theme. What about just giving them the paper and then saying, okay, lay down your pieces of collage.
Right.
Problem solving. Where are you going to put it? And you know what? They take a lot of time doing that. Yeah.
Titling the piece when they're done.
Excellent. I love that part of the experiential. It brings in a wholeness to it. Who is this person? What does it represent? What does it mean to you in your life? And titling it. And to that point, I've been working with a few people over the last 8 weeks at Aging in America in the Bronx. And what I found was that even though they didn't remember the title, when I went back to visit them in their room, I said, well, Annie, do you remember doing this? Yes, I remember the sea, and I remember this looks like the earth. And what did we call it? And I said, let's look at the title. And, you know, it enables them to repeat the repetitive, and that's what Perry talked about, repetitive. So the titling is a wonderful element. Broca's language. What I'm looking at in research at Cornell University is language. How the arts enhance language. When we're going to do an experiential and I ask you to give me an event out of your life, listen to the rich language people use. Your language is very different at different times of day and different times of your life. If I ask you to talk about your wedding day or your last vacation, that rich language is affecting our brain, and that's going to be the new wave, because we're going to see that art affects language, affects the brain. Reticular formation, the occipital area of the brain and the arousal area is one of the largest areas of our brain. And I always find this interesting as an artist, and when I like my special colors of purples and dark blues and reds, because in fact it's arousing ourselves in looking at these beautiful colors. Our brain is very sensitized to that. If we are emotionally well and emotionally happy, that's helping our cognition, it's helping our speech, and it's helping our overall functioning. Think about yourself when you are stressed, and that stress affects you. It affects your abilities. I think our emotions are very hooked into the art experience. Okay, so this is really the essence of the creative art therapies and the TTAP method. I was the first one to really make the correlation that in getting inspired, well, we can do that with object relations, and that's why we're going to have an experiential any second now. So hang on, you've been doing really well. It's 40 minutes into this. Visually, you're inspired by paint and color, reaction skills, body and movement programs, emotionality, looking at photographs. Photographs are much more powerful than I think we've ever given them credit.